Applied Prevention Science International presents Prevention Portraits, a series of informal interviews with scientists, professionals, and other stakeholders who are contributing to prevention knowledge and practice around the world. We hope to bring you closer to their brilliant careers, experience, and professional paths in the prevention field. On behalf of APSI, thank you for joining us. Enjoy.
Hi, everyone, and welcome back to Prevention Portraits. I'm Susan David of APSI, and together with our president, Dr. Zilli Sloboda. Hi, Zilli.
Hi,
we want to welcome Dr. Mally J. Paschall, also known as MJ, to Prevention Portraits. Dr. Paschall is a member of APSI Science Advisory Board and is a senior research scientist at the Prevention Research Center, Pacific Institute for Research and Evaluation in Berkeley, California. Hi, MJ. Thank you for joining us. We're delighted. We're looking forward to talking to you about your work and career. To get started, please introduce yourself and tell the folks a bit about your current research work and focus.
Okay. As you said, I'm a senior research scientist here at the Prevention Research Center in Berkeley. My background is in public health, and I do a lot of research here mainly on alcohol policies that focus on reducing underage drinking or hazardous drinking among young adults. So I've done research focusing on environmental strategies to reduce underage drinking, like enforcement of underage drinking laws like alcohol sales to underage youth or social host ordinances. Also, environmental approaches such as enforcement of overservice of alcohol to bar patrons and those kinds of things, DUI sobriety checkpoints.
Wow.
So we do a lot of that here at PRC.
Thank you. Zil?
Okay.
Yeah, MJ. It's so good to talk to you this way. Miss seeing you. I think the last time we saw each other was in Peru.
Yeah. Cusco. It's been that
right.
long.
Yeah,
wow.
It's been a really long time. Anyway, it's great seeing you. I think I'd like to just say that there's a background that you're unique in the field in that you do both epidemiologic work as well as do evaluations of interventions. And of course, you're looking at policies. So the research designs that you apply to that kind of work is a little bit different than what we do when we do, say, a classroom intervention. So where we might do randomized controlled trials, you do time series analysis. So that's I think makes you again very unique.
Yeah, for example, recently I've been doing research on recreational marijuana legalization in Oregon and California using data from statewide surveys of adolescents. So using data from the Student Wellness Survey in Oregon and the California Healthy Kids Survey, we've looked at both, the changes in the prevalence of marijuana use and marijuana-related beliefs among adolescents pre and post recreational marijuana legalization. So that's an example both of epidemiological research and kind of a time series analysis of, policy effects on marijuana use.
Is that research in publication now?
The Oregon study was published in the American Journal of Preventive Medicine.
Excellent.
And the California study is coming out in Journal of Studies on Alcohol and Drugs.
Very good. So our audience can look for those studies.
Right.
I think that's great because I think that's a really important question. The difference between medicinal marijuana, just the concept, the perception of what that means compared to recreational. marijuana must have a big impact on behavior, but we won't ask you to tell how it works out. People should go and look at the articles. When you started out, all of us didn't start out wanting to be in the field of prevention. Many of us started out in other areas and just sort of discovered this very exciting area. Can you tell us a little bit about your background?
Sure.
And training and your adventures?
Sure. Yeah. So I was as an undergraduate at UNC Chapel Hill, I was majoring in environmental science and engineering, also called environmental protection back in those days. So there was an environmental protection program in the School of Public Health for undergraduates. And that was my area of interest back in those days. There was a lot of excitement back in the 70s around, protecting the environment. There were Superfund sites, coming to our attention, and air pollution. And so there was a lot of movement towards really, developing strategies to improve environmental conditions. And of course, nowadays we're seeing, the
Yes.
results of all that, positive and negative. But anyway, that was my major as an undergraduate. Then I worked for a year in an organic chemistry lab at RTI in North Carolina. And that was interesting, but after a year in the lab, I realized that I didn't want to spend the rest of my professional life in a laboratory. And so that's when I started rethinking the direction I wanted to go in. And at that point, this is kind of an interesting part of my story too. I joined the Peace Corps. I just thought, I just want to go try to do something good in the world and think about, what direction I want to go in down the road. And so I spent about 2.5 years in a country called Lesotho, which is South Africa, very small country. And I was a teacher in a rural boarding high school. I taught science and math. And, but I was also interested in other things happening around the community. And one thing that I noticed right away, because it was fairly unpleasant, were these pit toilets that were right out in front of the school. There was a big block of them. And it was just not pleasant. I mean, they didn't smell good. There were like flies around everywhere. And in addition to that, the headmaster let his cows roam around the school grounds. Where cows go, they leave little presents or big presents.
Yeah.
And so, I just thought this is something that maybe I could do something about, and I remember our doctor, the Peace Corps doctor, was making rounds to visit all the volunteers in their sites. And she came to my site and we had a meeting with the headmaster to talk about what needs to be done about these pit toilets and the cows to improve the, sanitary conditions of the school grounds. So anyway, I was able to get funding to get materials to replace the pit toilets, and then nothing happened. The headmaster didn't bother to go get the materials, and just nothing happened for quite a while. And I thought, well, what's going on here? And I had conversations with him about it. He said, oh, yeah, I'm going to get to that. Don't worry. I'll get to it. And still nothing happened until one weekend, one of his cows, now you have to, the pit toilets.
Oh, no.
The toilets themselves, there was a long pit, okay?
Oh, no.
And the structure only covered about half of it. The rest of it was covered with corrugated metal. All right. And so one weekend, one of his cows stepped on the corrugated metal and went down into the pit, upside down.
Oh, no.
And this was an emergency.
Oh, boy.
Word got out quickly to the headmaster. He had a lot of students come out, and some of them got down in the pit and they tied ropes around the hoofs of the cow and pulled it out. They were able to rescue the cow, which was a pretty impressive, you know, thing
Yeah,
Yeah.
to do. But,
definitely.
but that was a turning point.
Huh.
That was a turning point. It was not long after that that those pit toilets were torn down and the headmaster showed up with all the materials for the new pit toilets. And I was able to get some students together and we constructed those.
Hmm.
And, you know, that's when I started realizing, oh, you know, things like there are a lot of interesting barriers to doing good things to improve health. And this is one
Yeah,
example of
yeah.
how
Huh.
there's important social factors, you know, and
Mhm.
economic factors that can influence um,
Wow. Hmm.
uh, what may or may not happen to improve health conditions in a community like that. And so that's when I started thinking, you know, maybe I should get more into the social sciences um, when I go back to school, which I did. So then I went and I got my master's in public health at UMass Amherst.
Hmm.
Um, After that, I got involved for about a year in some community partnerships to prevent,
Hmm.
you know, alcohol and other drug use up in Massachusetts, doing evaluation work. And that kind of inspired me to want to go back to school again and get my doctorate at UNC in the Health Behavior and Health
Mhm.
Education Department. Okay, so yeah, that's pretty much my story up to that point. So then in that program, of course, we had a lot of social psychology, a lot of, you know, all of our favorite health behavior theories, health belief model, theory of reasoned action, theory of planned behavior, behavioral economics theories,
Hmm.
sociological theories. And so I was learning a lot about, you know, factors that influence decision making among individuals and health
Mhm.
behaviors. Um, but there was one course I took that also kind of perked my interest, and it was an injury prevention course that was taught by Carol Runyon.
Oh,
Um, I don't
yes.
know if you know her, who
Mhm.
Carol is, but so she was the director of the Injury Prevention Research Center at UNC at that time. And in that course, I began to learn more about policy approaches to address public health issues. And so, you know, I was learning about policies that required people to have smoke alarms in their houses or wear
Mhm.
seat belts or
Hmm.
things like that that were really, you know, saving lives and that were changing the environment, you know. And Carol was really big on policies. You know, she would say, you know, it's important that you guys learn all these health behavior theories and understand more about how people make decisions. But let me just tell you, the policies are the things that really make a difference in you know, in this world. So that's when I first started getting interested in policy approaches to prevention.
Mm-hmm.
And but even then, it didn't really sink in. I kind of thought, okay, that's interesting. You know, I'm gonna just get this degree, you know, and get out of here and get a job, which I did at RTI.
Uh-huh.
So that's when I first started working with Chris,
Uh-huh.
Sure.
Chris
um,
Ringwald.
Chris
Yeah.
Ringwalt. That's right. And I remember at RTI, one of the first grants I tried to get funded was working with the Higher Education Center for Alcohol and Drug Prevention, which was based in Massachusetts. And they were doing a lot of work with colleges and universities to help them, you know, do more to address alcohol and drug problems. But they had an environmental management approach to
Mm-hmm.
doing that.
Hmm.
So I was interested in that because it was looking beyond the campus. You know, it was looking at what's happening in the
Mhm.
community that can influence alcohol and drug problems. So, for example, you know, they were interested in things like not serving or selling alcohol to underage students, um, trying to do more to regulate hours of operation of bars in the community, licensing of bars, and those kinds of things that I didn't really know that much about, but I began to realize that, oh, okay, these things are important too. You know, it's not just about
Wow.
changing attitudes and beliefs and knowledge. More needs to be done about the larger context
Mm-hmm.
in which these behaviors
Right.
are
Right.
occurring.
Hmm.
So that didn't get funded.
Oh,
Oh.
Didn't get funded. We were going to do an evaluation of their training because they were doing trainings on campuses, and they were getting this, the prevention coordinators and other folks at the universities to do environmental assessments. Where they would go out and they would look at how many bars were in the neighborhood and
Yeah.
yeah.
how much
Alcohol outlets.
alcohol outlets, how many of them were doing happy hours.
Mhm.
Another thing that could be potentially regulated.
Yeah. Yeah.
How many, how late were they open? Were they open all night? Another thing that could be restricted. And so those kinds of things were part of the environmental assessment. I thought was pretty interesting.
That's very interesting. Yeah.
Yeah. So at that point, I remember calling the program officer at NIAAA to figure out whether I should, keep trying to get this thing funded. And her name was Gail Boyd,
Oh,
I
yes.
remember. And Gail said, you should check on research that people at PIE are doing, and people like Alex Wagner, because they're the big names in the field right now.
And
They're the
policy.
people that are doing a lot of really good research in this area. So you should look into that, which I did. So that's when I got to know about PIRE. So, and at that point, I didn't realize it, but Chris was thinking about leaving RTI and going to PIRE, which he did.
Right. Yeah.
And then I followed him.
Oh, okay.
So that's how we came to PIRE. We both transitioned from RTI to PIRE in Chapel Hill.
Mm-hmm.
And I was still interested in, environmental approaches to prevention. And I eventually got a grant funded. My first grant was to do a study on the effects of college attendance on heavy drinking among young adults, using data from the National Longitudinal Study on Adolescent Health, which is now the National Longitudinal Study on Adolescent to Adult Health.
Mm-hmm.
Okay, they're still following those people.
Okay.
Yeah. So that was my first grant, and as that was getting funded, I was actually making the transition from Chapel Hill to Berkeley because I needed work, and there was an opportunity here to work with Bob Saltz on a study known as the Safer California Universities trial. And that was a trial with 14 universities here in California to evaluate various kinds of environmental prevention strategies, including some of the ones I mentioned earlier, like, doing compliance checks to prevent underage alcohol, being sold or served to underage students, to prevent overservice of alcohol, to prevent large parties. The focus of that study was actually on off-campus parties and related problems, because that's where most of the problems occur, typically around college campuses. Most students live off campus. So, so anyway, that was the focus of the study, and it was pretty interesting. There was a lot of emphasis on social host laws. Those are laws that can hold the party host liable, or the property owner liable, for either underage drinking on the property or some problems occurring as a result of excessive drinking. So that was part of it. There was DUI enforcement, and the universities were involved. That the folks in health education on these campuses were doing a lot to increase visibility of these policies and enforcement, and work with neighborhood organizations to try to increase awareness among students about these policies. So anyway, it was a pretty interesting study, and we did see beneficial effects of this collective, this collection of interventions in college communities.
I think your research is so valuable for that reason. And as you know, of course, that's why we have a whole session on universal prevention curriculum that we focus on this, because seems that a lot of communities could readily put these policies into place and really have a big impact on particularly alcohol, but also smoking.
Mm-hmm. Yeah.
But you're sort of talking about environments, and I don't know, do we want to get into the COVID situation and
We
some of your
can.
thoughts on that, or
We certainly can. I just think it's tragic as it is. It's really a perfect example of environment-based prevention, because what we're seeing are restrictions on where people can go. You know, businesses are not open the way they used to be. You can't go, you know, I don't know how many people are going to concerts anymore, but I doubt very many. Sporting events, you know, these venues where large numbers of people used to come together are just not happening now. And, you know, there's other businesses too that are somewhat open, but not as open as they used to be. And so the landscape has changed in terms of where people are going, where they might, you know, engage in drinking, for example, or in this case, expose each other to the virus. So those are, you know, I think the policies are really good. Of course, we're also hoping people are going to take all the necessary precautions they should be taking. And these are, you know, these are policies, but, you know, they're also not necessarily enforced the way they should be. Although I think there's a lot of informal enforcement. You know, most businesses have signs saying you got to have your mask on before you come in. So, you know, there's that kind of
but then they come off. Around here, they come off immediately, or they pull it down below their nose anyway.
No. But I think I was just going to say, so the issue of behavioral issues and is so strong, even though you have the policies and the issue of enforcement, which we always talk about, that if things are not enforced, they lose their power, they lose credibility. And so I think people are concerned now, even if we get, you know, injection protection, people are going to take the vaccines unless they're convinced that behavioral issues, decision-making and behavioral issues are just as important in environmental strategies and as others. Anyway.
Decision-making, but we sort of impose decision on you, and then this data indicate that once you change these kinds of behaviors, that the attitudes change also, as we've seen in some of the studies in Europe, which you've done a lot of work into connecting with international groups and using international data. You have any?
But I was just going to say one more thing about COVID-19.
Yeah, I'm sorry.
Another reason it's such a, you know, we've talked about both intended and unintended consequences of environment-based strategies. And so we see here both beneficial effects of the policies when they're implemented fully and people are comply with them. But then there's also unintended consequences. You know, people are losing their jobs.
Yes.
And, you know, that's tough.
Yes, and all these things have to be weighed. But then when you look at like Taiwan, for instance, where they haven't had any infections in the last 200 days, not one.
Wow.
So you can see the long.
You can see that if everybody did the right thing at a period of time, that perhaps we would be getting back to some kind of new normal.
Yeah. Another thing we're interested in here at PRC is, you know, home delivery of alcohol and other substances like cannabis
I was just going to ask you. I was going to ask you. Are you looking into some of these issues? And of course, I should know better. Of course, you are.
Yeah, it looks like I'm hoping we're going to do this regardless, but I'm hoping we're going to be getting a supplement to our center grant. But we're going to do it anyway. I mean, we're already incorporating questions in our surveys. We have a couple of longitudinal studies going as part of our center grant here in California that will get into, you know, how much people are now drinking at home versus anywhere else.
Yeah.
Whether kids are able to get alcohol delivered to home and cannabis products, because there's no enforcement there of checking age IDs. And a lot of the drivers just want to drop it off. They don't want to have to interact with people. So things get dropped off on the porch.
Yeah.
With no ID checking.
In
our state, I know the California Alcohol Beverage Control Agency has already done a small study of its own just to see whether underage people can order alcohol and get it delivered, and they can.
Yeah.
There's like literally no, or even if their parents order it and the parents are not home, it doesn't matter. It's still going to get delivered, you know. So that's something that we're interested in.
Yeah.
Heavy sigh.
Yeah.
Challenges. Opportunities. Challenges and opportunities.
But lives at stake. That's the problem, I think, here. Which is a problem.
Yep. Anyway, you were asking something else.
I was asking about your experience in working with internationally, working with scientists from other countries, working with data from different countries. Any kind of reflection on that effort? Doing cross-national studies, I think, in the health field is extremely important, because especially for non-communicable diseases like substance use, because of the cultural and the different policies in different countries. We learn a lot from that. So any observations or comments on that?
Yeah, I mean, I totally agree with you. There's a lot to be learned from comparing policies in different countries and how they relate to or impact substance use. One study that comes to mind that I was involved in with someone from New Zealand was using data from the European, it's called SPAD.
Oh, yes.
Survey on alcohol and drugs. And surveys like that from other countries, like monitoring the future data from here in the US and other youth surveys from other countries where we could get those data to look at the association between alcohol policies and underage drinking. And, you know, sure enough, there is an association. Stricter policies are associated with less underage drinking, and particularly policies that are geared towards affecting the availability of alcohol. So
that's pretty cool.
Yeah,
that's why that research is really important for our field.
Now there's a lot of interest in the decline in underage drinking. And so there's going to be a special thematic meeting of the Kettle Brewing Society next year on that topic. I'm interested in that too. There's been a big decline in underage drinking over the past 20 or 30 years. And why is that?
Yeah, looking at that cohort effect, because that's also a very interesting way of looking at our data, is just to see if there are cohort differences. I think that's important.
Yep, and there's a lot of different theories floating around about why this is happening. And you know, there's one study that came out of Finland that was pretty interesting. They have SPAD data there, and they just analyzed it over, I can't remember how many years exactly, but they found that perceived availability of alcohol decreased significantly, and that accounted for a big percentage of the decline in Finland in underage drinking. But parent monitoring also was an important explanatory variable. Those are probably the two most important.
Well, parent monitoring, we know, is powerful for almost all these behaviors in children. It's having the parents monitoring what's going on. Yeah. Susan, did you want to ask anything?
Well, there were a couple of things.
Okay.
Of course, we.
Sorry, we don't want to dominate.
No, I'm not going to tell it. I don't know. No. We always ask this question. when Zilly called you up and asked you if you'd like to participate in helping us do our universal prevention curriculum, why did you say yes?
He's going to say, did I say
Gosh, why
yes?
did I say yes to that?
I know, yeah, why?
I'm wondering.
Well, Chris kept badgering me. No,
I knew it would have something to do with Chris.
he did encourage me to get involved. And, I do listen to Chris every now and then. And no, it just sounded like a very interesting project. And in particular, because, it has to do with dissemination of prevention science. And that's an area that's, of growing interest and that we're making advances in slowly. And I thought, okay, this is an interesting model that would be interesting to get involved in and actually be a part of developing a training curriculum for developing countries and looks like the US too. So yeah, I just thought this is really different, and it's an area that I'm interested in, and I can actually maybe put to good use some of what I've learned in the field that I've been involved in. So.
And I thought one of the issues, I know you worked as a team on the project because that curriculum involves skills and delivery. And I thought maybe you'd tell us a little bit about working as a team with Sharon on and how that went together, because we hadn't done that before. We'd worked in the science knowledge side, and that was new for us. And I thought maybe you could tell us a little bit about your collaboration.
Okay. Yeah, I mean, I felt I was lucky that Sharon, I just remember maybe Bob Saltz recommended Sharon. I said, Bob.
See, this is Sharon O'Hara.
Sharon O'Hara. Sharon O'Hara. So Sharon had been working for many years, like 20 years, in training of coalitions through CADCA. With a focus on environmental prevention strategies to address alcohol problems. So she was ideal for me. I needed someone who really had a lot of practical experience and understood what a lot of the barriers were, for people to really have any success, getting environmental interventions implemented. For example, bringing about policy changes or getting better enforcement of policies or increasing visibility of policies and enforcement. So she was very valuable as a partner. I had more of the research background, and she had the very practical, experience to bring.
Yeah, and that's been so helpful. And we just recently put together a little piece, what we call one of our nuggets, just looking at and we haven't done it yet, we haven't finished it, but we have a draft of doing policy advocacy step by step, which came from the curriculum, and trying to do another package of the ways to go about doing it. Because as you pointed out with the latrines, it's not enough to even suggest it and have all the data and have all that. Something has to happen.
Sometimes something bad has to happen. That's right. Yeah. Unfortunately, that's what it takes sometimes.
Yeah.
But I was really happy about that module in our curriculum, because it's kind of doing everything you can do to increase the likelihood that you're going to get a policy adopted, even in the absence of some tragic incident that might,
Right. Yeah, it builds the story.
Yeah.
It creates and yes, I agree. I think you're right about that. And one of the things, a shared memory that we have, actually goes back almost exactly 4 years ago, today or tomorrow, was our experience in having the curriculum reviewed in Bangkok. And we literally were on the other side of the world during the US election. Gee, yes, here we are. the day before.
I know, isn't that interesting?
Isn't it a funny thing?
Yeah, I'm glad you mentioned that. That was a pretty surreal experience, as I recall.
Because you were in Bangkok, right?
Yeah, so we're in a different time zone. It's already kind of
12-hour difference. It was
crazy.
exactly the other. It was 12 midnight and it was 12 noon for us. And I think, to me, my sense of it was how much everybody around the room who came from Africa and other places, they were just as interested as we were in what was happening, which was quite a shared experience at the time. Anyway, just
We are a
personal.
global community. I think prevention professionals are also a global community.
Yes.
And it's been a wonderful experience. And for many trainings that we've done with the environmental curriculum, it's often people don't even think about that, of as policy as being a prevention tool, and how powerful it can be. And the history we have versus the tobacco in this country took a long time, but still we were able to make changes. And as you're looking at these cohort differences with children and alcohol use, I think heavy sigh. I think we're doing what we can. It's just taking a long time. And of course, I think young people are becoming more and more interested in this field. And I think that people like yourself and our other scientists are sort of leading the way and showing how you could not only have a good time, but also to really have a major impact on the health of communities. I think it's really important. Susan, anything else? MJ, any last words? I shouldn't say just for this.
The only other thought I had was going back to the decline in underage drinking and why is this happening? And so one of the popular possible explanations is the digital media revolution, social media. And is it just because kids, or at least since the 90s, are kids just finding this to be a more entertaining way to spend their time? Or is it really an addiction that's replacing
that's
substance
an interesting
use?
question, isn't it?
So,
well, we'll see another study by you.
Obvious.
Yeah, I'm trying to get my hands on the data.
Thanks so much for the time today, MJ, and thank you so much for being in this field, and just knowing you has been a great experience.
Likewise. Yep.
Thank you.
All right.
Thanks. Bye-bye.
Bye-bye.
Take care.